right. Good morning, everybody.
Good morning.
I said good morning.
Good morning.
All right. There we go. There we go. All right. How's everybody doing?
Good. Good.
Great. So welcome to the second day of Wellness Week, Spring Edition. Okay. Is there any new faces here at all? You are. Okay. Welcome. Welcome. Anybody else here new for the first time? Yeah, just leave them over there in case in the back they want to grab it. Okay. All right, so we do these events every couple months. All right, so I just wanted to let you know the next one will be July 18th through the 25th. Okay, so basically a little over 2 months. Keep that in mind when you're getting your things. Make sure you have enough to take advantage of the specials. Right, these are some of the best specials in the country. They really are. Okay, so for those who don't know me, I just wanted to introduce myself. My name is Mike Gallagher. I'm a certified lifestyle educator. I've been in the nutritional industry almost 20 years. And I'm only here during these wellness events. Okay, I'm not here normally at Dr. Waters' clinic, but I'm here to help him and answer any questions and help support him. So, we're going to focus on GI health today for this particular talk, but you can ask me any questions pretty much about anything, and if I don't know the answer, I will try to get it best for you as soon as possible, okay? There aren't too many questions that I haven't run into in these 20 years, okay? So, as I said, I'm normally here during these wellness events only. Normally, I actually travel around to different offices, to different clinics, and just show them this information, show them the research, show them how we can really change people's lives if we use the right ingredients combined with the right foods. Okay, I don't like to use the word diet. Diet to me is a 4-letter word. So more lifestyle, better lifestyle eating habits, reducing stress, and exercising, right? If we do those 4 things, we can really have an incredible impact on all different health issues, but especially for your stomach, okay? Especially your stomach is a big one. Let me unwind this a little bit, okay? So I work with a lot of different modalities. I work with some medical doctors in the area that are getting more involved in nutrition. Okay, there's a few out there in the area. A few DOs. I work with a lot of chiropractors. I work with some pharmacists. I work with some nutritionists. I work with some kinesiologists. I work with some psychologists and some psychiatrists. Okay, so, and I work with naturopaths. Naturopaths. So naturopaths, before medical doctors came to where they are right now, before that little known drug called anesthesia, okay, naturopaths ruled the world. Naturopaths until the early 1900s. Okay, medical doctors were known as barbarians. Surgery was brutal, as you can imagine. Okay, but naturopaths ruled the world. And the study of naturopathy goes back thousands of years, and naturopaths believe that everything goes back to your stomach. Every condition, every health issue goes back to your stomach. So if you fix your stomach, heal your stomach, it will help out with pretty much every known condition. And we really believe that as well. Dr. Weiner really believes that as well. Okay? They couldn't have been wrong for thousands of years, right? So it lasted the test of time, and not many people associate different conditions and diseases with their stomach, okay? But it really is connected, okay? So your stomach is known as your second brain. You ever hear that expression, go with your gut feeling, right? That's what we're talking about. Your stomach really is the core. It really is the center, and if we can fix your stomach, we can have a huge impact and a lot of other health conditions that you maybe never thought about until we talk about it today. Okay, so again, we know it's extremely important, okay? Cornerstone of overall health. Approximately at least 70% of your total immune system is in your stomach. And now you hear this advertised on TV. We've been saying this for many, many, many years. And there's some recent studies that say at least 80% now, 80% of your immune system is in your stomach. So we fix your stomach, you will get less and less sick. You will not have the colds and the flus. And if you're prone to those things, it's really at the start here is in your stomach. So let's go back to the foods, right? So I think we all learned a long time ago in grade school, you are what you eat. You are what you eat. And somehow as we age, we lose that message, right? And we get bombarded with all the fast food commercials and eat whatever you want and take this pill and you'll be fine, right? And that's, of course, not true. Okay, so if you eat healthy foods, which we call the Mediterranean diet, which we outlined in the brochure there that we gave each and every one of you, and we have extra ones in the back. Okay, so nothing crazy, nothing exotic, good lean sources of protein, organic as much as possible, or know your sources of local farmers and so forth, right? Chicken, turkey, fish, organic as much as possible. Limit your red meat if you're a meat eater. Of course, there's vegetarians, right? So fruits and veggies. Again, organic as much as possible, or know your sources. Good fats, good seeds, good nuts. Okay? Nothing crazy, nothing exotic, but just consistently eating these foods over and over and over again. Okay? Now, when we eat the wrong foods, the fast foods, the processed foods, medications play a role, smoking, of course. Over time, they create yeast, intestinal issues, toxins, and parasites. Over time, not one time, but over time. Okay, so we just take it one day at a time, one meal at a time, be consistent, right? We make decisions every time we put something in our mouth. So just think of that. Think of the long-term effects that this has of eating the wrong kind of foods. Okay, so we know it's one of the GI problems, one of the top reasons why people seek medical help. 70 million people suffer from some type of GI problem. There's 300 million people in the U.S. roughly, so a little over more than 1 in 5, close to 1 in 4 people. So if you have problems, you're not alone. Lots of people issues have this. So what is happening in your stomach is that macromolecules, things that should be inside your intestine, start deteriorating and start leaking out and going to the rest of your body, okay? And then it starts this whole chemical cascade processes, which starts the whole inflammation process, okay? So instead, things that should be outside the body now are instead passing through your intestinal barrier and enter the circulation, and this is what we call leaky gut syndrome, okay? So this leads to all of these chronic health issues that you maybe never thought that's related to your stomach. So rheumatoid arthritis, eczema, allergies. I just gave a talk on Saturday on allergies. The number one reason people have seasonal allergies is because of stomach problems, leaky gut. So yes, we have formulas like Air Max that we can give you temporary relief. It's like a natural antihistamine, works within minutes, but we don't want to keep taking Air Max for the rest of your life, right? No one does. We want to fix the problem, and it's really a gut issue. Irritable bowel, of course, colitis, Crohn's, of course, any of those major GI issues. But really, again, you may never think of rheumatoid arthritis, pain in my knee is connected to my stomach, but it really is. It really is. So it's amazing how people, or they say, I have acne on my face. Oh, that's really a gut issue. What? I'm talking about my face. Yeah, I know. But we fix the gut. we have a new accountant upstairs, and she was talking to me about her son, teenage son, who's 17, who is having acne. And I said, what does he drink today? Kool-Aid. Kool-Aid. Ooh. Yeah. Tons of sugar in Kool-Aid, right? Tons of artificial crap in there, right? So I said, let's get him off the Kool-Aid, and let's start the GI program. And guess what? His acne is almost completely gone, 30 to 60 days. Okay, so this does work, folks. It really does, if you give it a chance. Now, another issue, another reason why people have so many stomach problems is they are self-medicating with the non-steroidals, such as aspirin, Tylenol, ibuprofen, those type of medications, okay? So 44% of the population also are using self-medicate with the heartburn issues, right? Tums, Nexium, Prilosec, right? Almost half the country is taking these medications. Does anybody know who have never heard this before? So if you've already heard this talk, don't answer. But somebody who has not, how long are you supposed to be if at the very longest time of taking these medications? Does anybody know? A week? Okay. Anyone else? A month? Okay. 14 days. 14 days is the maximum time that you should be taking these type of heartburn, antacids, and medications. Okay. After 14 days, it starts this process where it shuts down your own body's ability to break down food, and you become dependent on this drug. It also depletes your body absorption process to be able to absorb your minerals. So this is a huge problem on these medications, is that it actually can cause bone loss and osteopenia and osteoporosis. Okay? So Nexium now, you don't even need a prescription. You can just buy it right over the counter. So in the advertisements for Nexium, I looked at this recently. I was recording something, and that advertisement came on, right? And I paused it right when it had the disclaimer at the bottom. And on the disclaimer says, do not use for more than 14 days without consulting your doctor. But they flashed that for a millisecond during the advertisement, right? So the medical doctor doesn't know any other answer, so they'll just keep taking it, and then you have more and more problems. It doesn't fix anything. So we're going to talk about our program today is actually going to fix the problem. So I mentioned the NSAIDs a moment ago. The NSAIDs. Does anybody know, again, who's never heard me speak before, anybody know how long you should be taking the NSAIDs? Your Tylenol and ibuprofen. 3 days. Never is good, but 3 days maximum. 3 days in a row maximum. There are studies that have shown after 3 days, it starts causing ulcers, GI lesions, and bleeding after 3 days. Okay, so people say to me, you mean aspirin too? Yep, aspirin too. Aspirin too. Aspirin is really one of the roughest, toughest things that your body can take. Okay, now again, I know if you have heart issues, or you've had a stroke or a stent, the medical doctors will recommend aspirin. We're not fans. In fact, we have studies in the back that said taking aspirin, especially for older, especially if you're 75 and older, can cause higher incidence of strokes. Can cause strokes. There's also studies now taking a baby aspirin a day causes 200% increase in macular degeneration. Taking a regular aspirin a day, 400% increase in macular degeneration. Okay? There's so many better things to use than aspirin. Fish oil, vitamin E, garlic. They do exactly the same benefits of aspirin, okay, without any of the negative side effects. Okay? But this is a huge problem. Taking your Tylenol and aspirin, you think, again, there's help. It helps you. Not long term. And again, 13 million people use it every day. 50 billion sold yearly. By the way, that's just United States. That's not the whole world. Right? So, then you wonder why we have stomach problems. So the stomach is an amazing basically a machine, but it's over 900 square feet. So if we stretched out your entire intestines, it would actually equal the size of a basketball court inside your body, okay? Think about that for a second. It's pretty amazing, right? It's designed to allow only healthy promoting nutrients, molecules, and substances through, right? That's the way it's supposed to work. But if you have these type of stomach issues, leaky gut, again, the molecules of all types are able to go around the cells and get into the circulation and starts this process, okay? Other factors besides what we talked about, corticosteroids, prednisone can cause leaky gut. Excessive antacid use, right? Tums and all those, we just talked about the purple pill and all that. Excessive alcohol, sugar, infections, stress, long-term antibiotics. Again, those should only be taken short-term. Okay, so you add it all up, you can see why people have problems. Because a lot of people take this stuff when they shouldn't be. Now, leaky gut is often associated with the activation of this called GALT, gut-associated lymphoid tissue. Okay? The purpose of the GALT is to provide the first line of defense. So it's basically your Marines, think of it that way. They have attacked the foreign invaders, okay, such as food antigens, bacteria, toxins. But when they activate it, they basically do too good of a job. They overproduce. And then this starts this whole chemical process of inflammation. And then they start attacking your other systems and your other organs. So during this activation, antibodies then produce these cytokines. And again, that affects your immune system. And then they use those to fight the foreign invader. However, they do their job, they destroy those invaders, but then they activate this whole inflammation. So there's the connection why stomach is with rheumatoid arthritis, okay? Why it is with any chronic health condition is with your stomach. We fix the problem with the stomach, it stops producing this inflammation, and then you don't have those other issues. This is primarily the majority of health issues why this works, okay? And then chronic systematic inflammation. Okay, so here's another way to look at this. Think of your intestine as a screen door, okay? As a screen. What's the purpose of a screen door or screen window in the summertime? Keep the bugs out from getting inside, right? Well, when you have this leaky gut, these little holes in your stomach, little teeny tiny molecular holes here, the bugs that should be inside your stomach now are leaking out throughout the rest of the body. So what we're trying to do is fix that screen door, okay? Fix that screen door. The medications do not fix the screen door. They block the screen door, but then that produces other side effects. What we are doing nutritionally here is we are fixing that screen door, okay? That's the difference between what our approach and the medication approach. And unfortunately, most medical doctors don't know this approach because they never learned this approach on this. So we can do a lot, fix the screen door with basically one formula, GI Complete. GI Complete, and we'll talk about that more here in a second. But the GI Complete, this is the most comprehensive stomach formula on the market, okay? It works extremely well. We've had incredible results with people who did this program, okay? And we'll talk about that more in a moment. Also, probiotics are very important. Digestive enzymes are very important. So those are really the keys when it comes to your stomach, and we'll break those down. Okay. With probiotics, okay? We actually have 4 different types of probiotics. Okay, so this is basically the good bacteria that's in our gut, okay? And people say to me, well, I eat yogurt, I'm really good, right? No. First of all, I'm not fans of yogurt unless it's organic, Greek, plain yogurt, okay? Secondly, you have to eat a lot of yogurt to equal what you can get in just one capsule. Okay, and we'll talk about that here in a moment. But depending on the type of issue you have, we have 4 different types of probiotics. So for your major GI problems, and how do we classify that? Colitis, Crohn's, irritable bowel, and celiac patients, celiac disease. Those are where we really recommend a superbiotic. And the superbiotic is right here. So this is guaranteed 52 billion per capsule. It's one of the strongest probiotics on the market, okay, per capsule. And we typically start with 2 a day. If you have, I'll just pass this around. You can check it out if you've never seen that before. If you don't have those major issues, also Candida as well, okay? It's the second phase of our Candida program as well. Then we would just stick with some of the other types. The second type of probiotic, it's called SBC, stands for Saccharomyces boulardii. This has 4 different ways you can use this, okay? Number 1, if you are on an antibiotic, you can take this exactly the same time. All the other probiotics you have to take an hour, at least an hour apart. This one you can take exactly the same time, and it has the most research to reduce antibiotic-associated diarrhea. Okay, so that's number 1. Number 2, for Candida, yeast issues, which 3 out of 4 women have, and 1 out of 2 men have. Okay, statistically. This is actually acts like a vacuum cleaner, and it really sucks up the Candida. Okay, so it's part of our candy kill. Our candy kill would be in the morning. This would be in the evening time period for Candida issues. Thirdly, C. diff. C. diff, which is running rampant in the hospitals right now and nursing homes. In fact, last year, there have been many reports that said it's an epidemic at Pittsburgh hospitals. Okay, so C. diff, which is excessive, going to the bathroom like 20 times a day, C. diff. And it is contagious by not even touching someone, by breathing on someone at hospitals, okay, and nursing homes. So if you have C. diff, this would also be very beneficial. Lastly, if you're going anywhere where the water quality isn't the best, such as Mexico or going camping for the weekend or the week, to prevent Montezuma's revenge, we would recommend that you take this a week prior to going to build up your immune system, and then continue to take it while you're on your travels. Okay, this will definitely help dramatically with those type of issues. And again, if you ever had that during vacation, it definitely puts a damper on your vacation. Okay, so that's the SBC. Now we have the regular probiotics, Frontier Biotics. So this is guaranteed 5 billion per capsule. Okay, 8 different strains, covers the entire range. Okay, so this would be once we get your stomach under control. Okay, so if you've gone on the superbiotics and you're feeling better now, then we transition to this one. Or you can just take prevention. Okay, typically for adults, 2 or 3 a day is all you need. Children, 1 a day. And it comes in a 180 capsule size. Okay, so this would be our regular one. By the way, you would have to consume 40 of those small little yogurts to equal 1 capsule of this. 40. Okay, you're getting teeny tiny amount of probiotics in yogurt, folks. Very, very small amounts. And then we do have a probiotic digestive enzyme chewable, Probzyme. So this is really 2 things in one. We have it sampled over there. Okay, so again, this would be great, especially for minor GI issues. So abdominal pain, bloating, constipation, diarrhea, acid reflux, heartburn, indigestion, okay? Minor things like that. You can do 1 with each meal. Or if you have like acid reflux, heartburn coming on, take 2. And it usually relieves symptoms within minutes. So it's like a natural Tums or natural antacid. And we have samples in the back for you to try if you've never tried that. Oop, fumble. Tried that before. Okay, so 4 different types of probiotics. Hopefully that breaks it down and you have a good understanding of where each one fits for your specific GI issue. Okay, so we call our GI program, we call it 5 R's. 5 R's. So there's 5 different ways that we're helping here. First, we're removing the offending substances, okay? So this is where food allergies, but I also use the word sensitivities. Sensitivities, because most people have this definition of allergies and they don't really associate it. But a lot of people are sensitive and they might not realize. Dairy is usually at the top of the list, especially, again, we're talking allergies, sinus issues, and we got to spell it out to people. So everybody knows milk, but cheese, pizza, ice cream, yogurt, cottage cheese, regular butter, yeah, all the good stuff, all the fun stuff. But yeah, some people are very sensitive, especially if you have any sinus or lung issues. Those inflame it. So I always say, give me a week, try a week, avoid those foods, see how you feel. Give me another, after that first week, you usually feel better, say give me another week. Hopefully you feel even better. After that week, I say give me another week. Okay, take it a week at a time. Why? Because it takes 21 days. 21 days to remove these foods from your system, to get them completely out of your system, to avoid these sensitivity issues. But corn is at the top of the list, soy protein is at the top of the list. So we broke it down. I don't think we put it in there. We put it in our allergy brochure for you as far as the foods that we want to avoid. Gluten, though, definitely on that list. Okay, so we want to remove the food. So a lot of people say to me, well, they say to me, I don't know if I can do that. Well, you're not really going to get the benefit. You're kind of just spinning your wheels, right? You're going to neutral. So we're trying to heal your body, but if you keep taking the foods that are triggering that inflammation process, how can we really help you, right? So I know it's a challenge, but you can do it if you want the best, fastest, quickest results. Okay, replacing the digestive enzymes. Fiber also plays a role. Are you eating enough fiber in your diet as well? Reinoculating is the third step here. That's where the probiotics come into play, the good bacteria. Okay. Fourth, repairing, fixing that screen door, right? That's repairing, that's regenerating. That's what the medications do not do that we are trying to do. And lastly, relief, as I mentioned an earlier ago, acid reflux, heartburn, indigestion. Just using Probzon typically works really well. If you're constipated, we have our Frontier Cleanse, which is a mild colon cleanse issue. So that's the program, folks. 5 R's, putting it all together. Now, what supplements really help with these issues? Okay? So again, when we go through this, not everyone will be specific for you, but we just wanted you to be aware that we have a lot of options on this and how they fit, right? How they work with each issue. So Microgon or Paracleanse. So Microgon is an herbal tincture, okay? Again, this would be excellent for parasites and microorganisms. If you prefer the pill, Paracleanse, right? Okay, so does everybody have parasites? Yes. Yes, they do. We all have them. Okay, some obviously are worse than others. Okay, so we recommend doing a parasite cleanse once a year. And typically, if you're doing the pills, we recommend 6 a day, 3 in the morning, 3 in the evening. And it does take, we recommend 2 months. Okay, so 1 month to kill the parasites that are living right now, but unfortunately, they're laying eggs. And in the second month, that's why we take the second bottle once they sprout up, shall we say. Then we got to kill that second round. So that's where really it's a 2-month program for parasites. And again, this is where it can relate into a lot of different issues, parasites. But Dr. Weiner, obviously, if you heard his radio show, talks about parasites all the time. It's one of the most often mislooked, misunderstood, often overlooked, on that. The tincture, you do 2 droppers in the morning, 2 in the evening. All right, there's the GI Complete. There's the SBC Fiber. So our fiber formula is called Frontier Fiber. Okay? It's a patented form of fiber. It's odorless, it's tasteless, there's no grittiness at all. 1 tablespoon is equal to 5 grams of fiber. It's recommended that we want at least 20 grams a day of fiber. And where's fiber in? Fruit and veggies and certain nuts. Again, where most people are not eating those. So you can put that in anything, water, shakes, anything for you on that. And our greens, I forgot to bring the greens, but we have, again, have samples of that in the back. So again, GI Complete covers that aspect of it there. Okay, replacing. So there's the fiber, betazyme. So let's talk a little bit about betazyme. Okay, so betazyme is helping with your stomach acid, gastric hydrochloric acid. Okay, so this would be hugely beneficial, especially if you don't have a gallbladder. Okay, the main function of a gallbladder is to remove excess bile from your body. Okay, when you eat fatty foods, that's when you really need your gallbladder. If you don't have a gallbladder, it's very difficult for your body to do that. Okay, so this would actually take the place of a gallbladder, and you would take this one with each meal, or especially one every time you have a fatty meal. Okay, or you can just take that if you start having digestive issues 2 hours after you eat, you start getting bloatiness, right? That type of issue, that's also where the betazyme can be very helpful for, 2 hours after you eat. So, without a gallbladder, and it works almost immediately, you notice almost immediate relief of those symptoms if you take that. Yes? Question? Do you have a question? No? Okay. Yeah.
Refrigeration, very important.
Yeah, refrigeration, we just recommend it to be, the studies we've done on all these are really kept at room temperature. So we don't want to keep it in the car when it's now 90 degrees out, right? Or, you can always refrigerate it. It's not necessary. Even the probiotics, we've done studies where we kept it at 2 years at room temperature. But when it's summer months, we do recommend that, if you don't use air conditioning, to put it in the fridge, just to keep it as fresh as possible. Okay. Then we have another type of digestive enzyme called Sybzyme. And Sybzyme is more for the first part of your digestive process. So again, if you're having bloatiness, issues, gas, things of that sort, Sybzyme is your everyday digestive enzyme. Okay? So it's within the first hour. If you have those issues, that's where the Sybzyme can work. Okay? We also added a new ingredient in there called DPP4, which has been shown to helps with gluten and breaks down the gluten protein. And we don't want you to eat any gluten, but gluten is found hidden in a lot of foods. So if you have any gluten sensitivities, you don't have to be a full celiac, but if you have gluten sensitivities, Sybzyme would also really help with that issue. And again, that typically works very quickly, within minutes, if you take that, if you have those minor bloatiness type of issues. Okay. Reinoculate, that's the probiotics. We talked about those. Again, all the different options there on that with GI Complete. Repairing, fixing that screen door. So there again, GI Complete, you see it on every one of these because it does all 5 of these benefits. Fiber also helps, greens also helps there as well. Okay. So the acid reflux heartburn, that's where the Probzyme fits in. The diarrhea, the SBC. If you're constipated, the fiber would help. But the other one here that I, again, just want to mention is the Frontier Cleanse. Okay, this is a very, very mild colon cleanse. Okay, the way we recommend this if you are constipated is 4 capsules 1 hour after lunch, all 4 capsules. If you don't have a bowel movement that night or by the next day, the next time you take this, bump it up by 1 capsule, you bump it up to 5 capsules. If you still don't have a bowel movement, next day bump it up to 6. Okay, but most people 4 works really well. And you just take whatever dose it takes for you to have that bowel movement, you just stay at that dosage till you finish a bottle. So it's a very, very easy colon cleanse to take and utilize. So again, we want you to have at least 1 bowel movement a day. We'd like you to have more than that, but let's just start with 1. If you don't have more, if you don't have at least 1, then we do classify that as constipation. And that's where the Frontier Cleanse can be very, very helpful in that formula. Okay, so you put it all together. here it is in a nutshell. So the GI Complete, if you have any major GI issues, 2 scoops a day. 1 scoop in the morning, and also 1 scoop in the evening. Just mix it with water, tastes like fruit punch, okay? Once you start feeling better, then you back it down to 1 scoop, but we start with 2 scoops. It's that simple. Then you can do any of the probiotics that we talked about. Again, major issues, superbiotics, or for minor issues, the Probzyme or the Frontier Biotics.
Is that with food or without food?
With food, we recommend with food on that. Now we do have a capsule option now available on the GI Complete, but just so you're aware, 7 capsules equals 1 scoop of the powder. So if you're recommending initially 2 scoops, that means we're doing 14 capsules. Okay? So just want to make sure you do take enough if you go the capsule route, if you go that route. So very similar ingredients between the two. So by the way, this is the simplest GI program that we've ever seen in the nutritional world. Some of the companies I used to work with, that was the GI Complete was 4 separate supplements that we combined into one. So that's how powerful it really is. It really is. So what's in it? Glutamine. In the powder, 5 grams. In the capsules, a little bit less, 3 grams. Glutamine is amino acid. Again, it helps with the inflammation. It helps cooling. It helps as well fixing that screen door. Regeneration. Second main ingredient in the GI Complete, arabinogalactin, which is a really good Scrabble word, right? But most people have never heard of that, but they have heard of echinacea. So this is the active constituent, the immune constituent of echinacea plant. And not only help with your immune, but it again helps support the good bacteria. So when you combine it with a probiotic, that's a really good, powerful combination. My favorite ingredient of all time, dimethylglycine, DMG. Could do a whole talk just on this, and I have. There's thousands of benefits, but it's your master methylator. It's going to enhance any other supplement you take it with. It's going to make it even more efficient and more absorbable. Deglycerized licorice. So this helps with the stress and the inflammation and soothes the intestinal wall and relaxes. And then the aloe vera, which again we do sell separately, but it's in the GI Complete. Has again many different properties, antifungal, bacterial, viral, again calms and cools and reduces stress and detoxifies as well. Slippery elm, another herb that's been used for centuries, has very similar characteristics as the aloe. And marshmallow root, and this is a different marshmallow that's what's in s'mores. So this is actually again a plant, an herb that's been used for centuries. Again, very similar characteristics, very calming, very relaxing, and detoxifies as well. And then lastly, zinc carnosine. Zinc carnosine. So this is a special type process here. It's not just zinc, it's not just carnosine. It's a bonding process they use that makes it 3 times more absorbable. And this actually has over 20 published studies just on this one ingredient alone, which has been shown in just 8 weeks to reduce indigestion, 92 to 100% relief of issues. Also, there's studies on this with H. pylori as well. So if somebody has H. pylori, GI Complete would also dramatically help with that. Okay, so probiotics, the Probzyme, we talked about. I just want you guys to look at that picture for a second. This is what happens when we're not eating the right food, folks. This is what's happening. The yeast, the parasites, the fungus, if we could take a picture. So just in case you're tempted after we walk out today, you walk home and you pass by a Dairy Queen and you're like, oh, that looks good. Remember this picture. Keep that in mind, that is what will happen when we eat those bad foods, okay? So just think about that for a second. And how many bacteria, we talked about this before, there's more bacteria in your digestive tract than there's cells in your body, and there's trillions of cells in your body, okay? Think about that. Over 400 different species of bacteria are in your stomach. So that's why you need a probiotic every day, because that battle is going on every day, good versus bad bacteria. Unless you eat 100% organic every single meal, every single time, which we know is almost impossible, right? So that's why you need a probiotic, and that's why yogurt doesn't cover it, okay? Yeah.
What about the greens? How the greens?
Yeah, there is some probiotics in the greens as well, right? Yep. There are definitely some benefits of the greens.
Would that be good to use then if you
Yeah, absolutely. Okay? So these are just the different strains: Acidophilus, Bulgaricus, Lactobacillus, Bifidobacterium. These are all different strains. They cover the entire digestive tract that are in the Probzyme and also in the Frontier Biotics. Yeah.
You had a slide earlier, you don't need to go back, but it said Probzyme you take before your meal.
I tell you, like right with your meal, like right before.
If I eat, then I take it right after, or you should take it before?
If you have we recommend right before because of the digestive enzymes. But again, if you have acid reflux, heartburn, any of those things, just take 2 when you have those events, and those usually minimize the effect. You know, the
That's Probzyme.
Probzyme, the chewable, yes. Okay. Yeah. So this is an incredible, very simple, easy program. And you guys each have this brochure, right? We have extra ones up here. We try to break it down, give you all the different options. Obviously, we want you exercising, different forms there, relaxation and sleep techniques. I always recommend deep breathing exercise. It's the simplest, easiest thing on that. There's the inside right there, right? So we broke it all down, all the different options for you, but GI Complete would be our number one. These are the foods, things we want to focus on every day, and the things that we want to avoid as much as possible for the food aspect of it to get the fastest, quickest results. By the way, we've had people with colitis, bleeding, flare-ups, just using the GI Complete Superbiotics in just a couple of days, complete remission. Complete remission. There's another doctor that we work with, his wife had such a reaction to foods that she got hospitalized, and he actually had to intravenously put GI Complete in the feeding tube, and they actually said it saved her life. Saved her life. So we've had some incredible, incredible results. Yes?
The black walnut, the green, all powder, what's the benefits of that?
Black walnut that's in the Paracleanse?
It's in a couple of different products.
Yeah, it's a good antiviral, antibacterial, antifungal, and candida killer. So that's the benefits of it. It's not the actual walnut itself. It's not the protein. It's from the outside cover, the sheath. So even if you have peanut sensitivities or walnut sensitivities, you can take that without a reaction. Okay? All right, folks, my time is up. I will be giving you another talk here a little after 12, so we can have time to browse around, grab something to eat, or go to the bathroom, and I'll be back here in a little bit. Doc actually is coming, he's traveling back from Florida. There was a big conference in Florida, so I'm going to be filling in for him today at the 12 o'clock hour, and then he will be back. He said he promises if the 3 o'clock hour, he will be back to do his talk at 3 o'clock today. All right, again, everything's discounted. Thank you so much. Have a great day. Bye now.
Thank you.